Rafael Nadal is known as the King of Clay, and is currently the Grand Slam King with 22 conquests. But beyond the talent of a genius, it is the courage of a brave heart. The story of Rafael Nadal's Mueller Weiss syndrome goes back 17 years. It's not new, but the topicality never cools down. Those who have witnessed the image of the Spaniard having to move on crutches at the end of 2018 will appreciate the recent Roland Garros 2022 victory. It was probably the most beautiful championship of Rafa's entire career. So, let's talk about the so-called Mueller Weiss syndrome that Nadal has, is and will continue to suffer from for nearly 2 decades. Marca newspaper published the opinion of an expert in this field, Mr. Gilbert Versier, former head of the orthopedic department of Vincennes Hospital in France, so that fans could better understand Rafa's suffering. Dr. Gilbert Versier said, "This is a rare disease, but its sequelae are persistent and seriously affect the patient's quality of life. There is not a really clear explanation for the origin of the Mueller Weiss syndrome. Basically, with Mueller Weiss patients, the arch of the foot is more pronounced, and the distance between the sole of the foot and the floor is greater than in the general population. Instead of contacting nearly the entire sole of the foot to the floor, the Mueller Weiss patient has a dome that arches up and creates an opening." Former head of orthopedics at Vincennes Hospital added, "Of course, the disease will make it difficult for patients to move. Their every step became heavy and painful. But the most worrying thing is that when the blood vessels are compressed for many years, it affects the pelvis. The compression of the pelvis can lead to gangrene." Medicine has not found a clear origin of the Mueller Weiss syndrome. And especially, it happens very rarely in young people. Dr. Versier explains why Nadal is one of those few. Mueller Weiss is not a disease that progresses rapidly, but deteriorates over a long period of time. Osteomyelitis is common in women over the age of 50 as one reason. People with broken bones, in the process of improper recovery, can also be the source of Mueller Weiss. How did Nadal sacrifice for tennis? Rafael Nadal was diagnosed with Mueller Weiss at the age of 19. That was when he first got his hands on the Roland Garros title, in his first entry. From 2005 as a teenager to as a man entering the end of his career at the age of 36, Rafa's 17 years have been millions of painful steps. For the average person, a limp would be difficult. But for a professional sports athlete operating with the highest intensity, it is also a horror story twice as much. Many times on the clay court, the king of Roland Garros slipped and fell. Sometimes he fell because he tried too hard for an impossible ball. But there is also a time when Mueller Weiss causes Rafa to collapse. Before the match against Novak Djokovic in the last quarter-finals, Rafael Nadal admitted that it might be his last appearance as a professional tennis player. Over the years, when the pain was excruciating, Nadal was forced to prepare for a life without playing tennis. He founded the Nadal Academy in his hometown of Mallorca, willing to become a devoted teacher. In fact, the Mueller Weiss syndrome in Nadal is not insurmountable. A treatment regimen with multiple surgeries can solve the problem. However, as Dr. Versier revealed, that means Nadal's peak tennis career will be over. Simply because with people who have surgery to treat Mueller Weiss, they will not be able to walk normally for a long time, and then be able to walk like everyone else. Above all, in top sport, any partial bone resection is not permitted. So, one day to become a normal person with painless walking, Rafael Nadal will have to give up tennis. With NHM, enjoy the pinnacle matches of a genius with a brave heart.